Hey there, Dr. Monica Aggarwal, your favorite preventive plant-based cardiologist, keeping you up with the news. So, menopausal hormone therapy, can it be used to minimize hormonal symptoms? So, 30 years ago, we were saying, yes, everybody should take hormone replacement therapy after menopause because it was offering heart disease protection. Then we had the HERS trial and the WHI, and we found that people who were using hormone replacement had increased rates of heart disease. So we went the other way and said nobody should use hormone replacement therapy. But the answer is somewhere in the middle. So it seems to be that in low risk patients, low heart disease risk patients, that we can use hormone replacement therapy for mitigating or decreasing hormonal symptoms, usually within the first 10 years post menopause and under the age of 60 is sort of a general rule that you can use hormone replacement therapy, but certainly not for heart disease prevention or protection. So if you talk to your doctors, then they should be able to help you with this.